Janice.
Hello everyone, welcome back to my channel, Shay Janice. And today is a little bit different. I'm not reviewing a show. I'm not doing like a wine review or anything like that. However, I'm going to take you all into something very personal. I spoke about this just a little bit on TikTok, but I had a surgery recently. I had a breast reduction about 5 months ago. And so I want to kind of get into why I made the decision to have a breast reduction. And honestly, it did not come easy. It's something that I was told to do probably about 3 or 4 years ago, honestly. But I kind of just wanted to weigh my options and kind of see what was going to happen before I actually had this surgery, because honestly, I'm afraid of surgery. It kind of freaks me out. And so I really didn't want to have a surgery. So I decided to get a breast reduction because I had been experiencing back, neck, and shoulder pain for years, and I felt like it was just not getting any better. And so I had went to the doctor a few years ago, and my nurse practitioner actually told me, hey, it's probably due to the size of your breast, because basically my breast to body ratio was disproportionate. I'm a very slender person for the most part, and I had huge breasts, so they stuck out. They were very noticeable. I'm a small person, so that was what she told me. And so when I went back to the doctor last year, after trying physical therapy, trying a chiropractor and pain meds, I told them about my back pain again, and I was like, is there anything else that I can do? And she told me basically I probably should be referred to a surgeon to see if I should get a breast reduction. And so I finally said okay, and I went for a consultation earlier in 2023. And I was very nervous, but I was like, okay, I'm nervous, but let me make sure I ask all the questions I can possibly think of, as well as do some research on my own through YouTube, TikTok, Google, whatever. I did some research before I went to my consultation, and I asked these questions. So here are some of the questions that I asked. I asked how long the surgery would take. I was told it would take maybe about 3 hours. I asked about the recovery time. I was told 2 weeks and a year for full recovery. 2 weeks was for me to basically say that I can go back to work. And then I was told a week at one point. So yeah. And I was told not to pick up any pets or children. I asked about how it would go the day of the surgery. I asked if there were other options like laparoscopic options instead of having a reduction. And my surgeon said he'd never do that due to inflation of the breast, I guess. So that was a no-go for him. I asked about the scarring, because who wants to have scars? And I was told that I would have minimal scars. And then I asked a very important question, especially when it comes to Black women or people of color, about keloiding. And I was told that I should be a good candidate because I had not keloided from anything else in the past. But if you have a history of keloids, then you may end up keloiding. So I asked if my nipple would have to be removed. I was told no, unless unpredictable things happen. However, they would resize my areola, cut it down to match the new breast. I asked, did the reduction include a lift? That was a yes. I pretty much knew that, but I wanted to make sure. And I asked about possible complications, which is very rare apparently. And then I asked, when I have children in the future, have they had patients come back to get another reduction? So that was a question. Some people have had to do that depending on what happens to their breast during their pregnancy. And then I also asked the cost with insurance and without insurance. But I was told that the insurance that I had pretty much would cover it. They are pretty easy to work with.
Hey, cutting in here. I forgot to mention that during your consultation, they will take pictures of your breast to send to the insurance company as well as for the surgeon to review. Also, I was told that my insurance company was really easy to work with and that they typically approve the reduction without any issues. And that is exactly what happened. I received a letter in the mail saying that I was approved and that I needed to set up my surgery date and that I had a time frame to do it because I believe after a year of the consultation, you have to have another consultation for it to get reapproved. All right, on to the next section.
All right, so now I'm going to get into my pre-op. My pre-op happened some months later. I decided to schedule this surgery, until I was done with vacations and different things, so I can get that out of the way because I didn't want to be all stitched up or trying to recover and I'm on vacation. That's no fun. So I waited a while. I waited until late August to have the surgery. And for pre-op, I went in, I believe, a week or two before I had the surgery. And they told me they would give me 2 surgical bras the day of the procedure. But the surgical center would have everything that I needed, like the gauze and things like that. But later on, I'm going to get into some things you should get anyways. I was told that you can wear your own bra after 2 weeks with no wire and it not being tight. And I don't suggest people wearing wire bras anymore. I think those should be done away with because why? The second week, I was told that I may feel the pressures of the surgery. So I probably would feel more discomfort during that time. I asked about a uniboob situation because I was researching other surgeons in the area, and the reason why I chose this particular surgeon was because it looked like other surgeons, it looked like a connecting boob situation, and I did not want that. I don't know what that was about, but it was the pictures that they had on their website, so I just made sure to ask about that. With my case, mine were kind of spread quite a ways apart. They can't change that. They can only change the size of the breast and not how close they are. But I'll get into the day of the surgery in the next video. I was told I would need constipation medication. I asked about going back to work. They said if I feel like going back to work in a week, that would be fine. They informed me that they would not use drains for my surgery. A lot of patients that have had breast reductions have had drains, and my doctor does not use drains. And I was like, okay, whatever. So I used a lot of gauze, I will say that, and I'll get into that. Also, after surgery, you can't take a full shower right away until after your post-op appointment, and so you only can wash the important areas, but you're not doing anything anyways, so you should not be working up a sweat or anything like that. But still, of course, wash the important areas, you know what I mean? You still don't need to be funky during this time. I was told not to use any scrubs on my body before surgery or after surgery for a while, and that was pretty much it. I was also told not to use lotion the day of the surgery as well. So I'm going to get into some of the things you need before you have a breast reduction surgery. Here they are. Number one, you need a caregiver who can get you food or who can cook. Meal prepping is also an option, but you need someone to take care of you. You need them to maybe help you wash those important areas, depending. Thank God I had my mom. She helped me out a lot. You also need to go ahead and order you a few surgical bras or zip up sports bras. Also, make sure you have some comfortable clothing, some oversized clothing, and some clothing that either zips or buttons up, so that way you're not trying to lift your arms over your head after surgery. You also need to get a protective style if you are a Black woman, okay? We know how our hair can be, so I suggest having a protective style before you have this surgery, so you don't even have to worry about your hair. You need a back support pillow. You need a seatbelt pillow to go across. You need extra gauze. You need snacks. You need laxative. You need a show and a list of movies to keep you entertained during this time, as well as patience. You really need patience during this time. So those are a few things you need to have before you have a breast reduction surgery to make your journey just a little bit smoother. I did not have all of these things before surgery, but I had most of them. I had a caregiver. I had bras and comfortable clothing. I had a back support pillow, a seatbelt pillow. I had a show and a list of movies to keep me entertained. I had snacks, but I did not have extra gauze, laxative, or much patience. The experience was nothing like I thought it was going to be. But to see how my experience was, please check out my next video that I will upload on the subject. I hope you all gained some information from this video. If you have had a breast reduction and you have some other things that people may need to get, please go ahead and comment those items in the comments for me. We want to make sure people have a pleasant journey on their breast reduction journey. So yeah, thank you all for tuning in. Keep coming back. Go ahead and like this video and subscribe to this channel. Thank you all. Bye.